Hi, my name is Abby Miners.
I'm Sydney Rose.
I'm Hannah Bernard.
And we're here to talk to you about supporting treatments in families.
Staff!
The social issue that we are here to talk about is the amount of children in foster care due to parental drug abuse in Kentucky. Child welfare has been started in the 1800s. Society of Prevention of Cruelty of Animals, also known as the SPCA, was founded right before the child rights were enacted. Children were viewed as parents' property, so they were able to do whatever they wanted without getting in trouble. There was a case in 1874. Mary Ellen was a little girl about 7 or 8 years old. This changed the course of child welfare forever. Mary Ellen was beat many times by her parents and locked out of her house in the freezing cold. And one night, a neighbor was very, very nervous about that, and the case went to court. And that was when the Society of Prevention of Cruelty of Children was founded. In 1915, the Child Welfare League of America was founded, and it proposed a standard of services to children. In 1974, the Child Abuse Prevention and Treatment Act was passed and required citizens to report any child abuse or neglect. And the Adoption Assistance in Child Welfare Act was enacted in 1980, which prevented the removal of children while the parents were making an effort to reunify the children, and in a timely manner.
So, focusing more on how that intersects with parental drug abuse, Kentucky has started the START program, and what it is, it's an integration of addiction services, family preservation, and community partnerships in child welfare and substance abuse treatment. And how they decide to do that is the program pairs a CPS worker with a peer mentor who has at least 3 years of sobriety to work with the family, and that provides a different level of support for the parents to just give them kind of a leg up in this situation. Something that the START program has found, though, is that they're having a little trouble engaging fathers more so than they are having trouble engaging mothers, and this leads to problems with sobriety and permanency for children within the home. So our program, how we're going to engage this population, we would like for the population to be voluntary, but most of them will be court mandated because they would already have been working with a CPS worker, and in which case they will really have no choice about getting treatment or anything like that. The CPS worker, like I said, can mandate their clients to participate in their program, and this will help them follow their treatment and case plan. So the root issues of parental drug abuse, there's a stigma for getting help, especially within the smaller communities wherein this problem is bigger. Nobody really wants to help those who suffer from substance abuse, so it makes it harder for them to go out and ask for help in the first place. And most of the people who suffer from substance abuse within the CPS and child welfare system are of a lower class, and so the system is the addiction treatment system is kind of set up against them in the first place. And within Kentucky and the Appalachia area, there is a bigger issue of the opioid crisis, in which there is just a plethora of children who are in foster care due to parental opioid misuse. Some of the key community members would obviously be the CPS workers because they will be contacting us and getting their clients in touch with us to work within our program. And other key community members would be like school teachers or healthcare providers and other mandatory reporters. So the supporting treatment of families, also known as staff, our vision is to keep families together, and we want to do that by providing families struggling with substance abuse support. Our core values include strength, advocacy, and empowerment, and we want to use that for the parents because even though the goal is to keep kids out of foster care, by supporting the parents, we'll be increasing their permanency. Our program components, we want to provide specialized and unique programs for mothers or fathers. We're going to have a program time limit, and that's because there has been a study saying that children who return home before 6 months in foster care have a higher rate of reentry into foster care. And so we want to end the program at about 6 months, so then the rate for permanency is increased. Parents will complete a variety of programming to strengthen sobriety and parenting skills, and as you can see, we have a whole lot of classes to help them do that. That includes parenting classes, ongoing treatments, peer support specialists, weekly check-in meetings, 12-step meetings, and gender-specific group meetings. And also something that we thought of that would be helpful would be anger management classes or other classes that would be required by CPS.
And so this program both has, or our potential program, would have a lot of strengths, but also a couple of weaknesses possibly. So some of the strengths for this population, for the program, would be that this population of parents involved who have issues with substances, oftentimes parents, they'll want to get their children back. Even though they've made mistakes, they'll have a lot of resiliency within the family. And that will be a motivation for them to complete their treatment and to complete their CPS case plan to get their children back. And a couple problems the program may have would be that extending the time frame, like Hannah talked about with the 6 months time frame, that would be changing laws and regulations that have been in place for a while, so that might be a little difficult. And also the focus on sobriety, it might not solve all the family's problems. And that might not be the reason abuse or neglect has occurred. That might just be like a co-occurring factor. And despite how I just said it's because the parents are resilient and they would want to get their kids back, it's still, sobriety programs require client accountability. And so if they're court ordered to do this, then they might not do it that much. If they're not court ordered, they might not really try their hardest at the program because they're not being forced to. And it also does not guarantee continued sobriety in the long term. And so here's a layout of our financial budget for the program. So we would expect for a lot of our money to come from grants and donors and with Medicaid to help pay for some of the caseworkers and the support team. And so our staff would be, each client would have a case plan with a CPS caseworker, their substance abuse treatment caseworker, their peer supporter, and then also a specialized staff caseworker. So really the only thing we'd really have to pay for would be that caseworker for the staff program. And non-monetary, we actually have a lot of things that would not need to be really paid for because this program doesn't require a building. Our classes could take place at churches, libraries, rec centers, YMCA, anywhere really with a building. And the staff would only really need a couple of rooms to maybe have like a board meeting or a staff meeting, and then just a place to keep case files. And since it would be working with CPS, we could probably maybe swing a few rooms there. And they could have the team meetings at their rehab facilities or things like that. And a lot of the classes could be outsourced or referred. Like they could take parenting classes at other agencies and they would do their own NA classes. So not necessarily something we would have to provide, just something we would kind of like get together for them. Mm-hmm. And so measuring if the program's effective would be in two different ways. So we'd want to measure short-term and long-term just to see how it would all work out. So short-term, we could see how many families who have graduated the program continue to be involved with CPS. How many kids go back into foster care after their parents have graduated. And also we could do a survey for the staff involved in the program and for the participants who's graduated to see what did you like about this, what could be more helpful. And also get an outside expert in foster care, substance misuse, the integration of the two of those to kind of look at all the aspects of the program and see, if they like the way it's going. And long term, we would want to measure if the total number of families who are involved with CPS and who have a history of substance misuse decreases over time, to see if maybe our way of working kind of helps the population as a whole. and then again an outside expert to evaluate the program goals and implementation in a long-term kind of way. To conclude, we think that this will be a really successful program if it could work. We think by providing gender-specific support for parents who are struggling with substance misuse, we're going to close that gap that START has with staff through definitely individualized programs for mothers and fathers. And we're optimistic this program will work because we want to reduce the number of children in foster care with the extended time limits, to give parents more time to become sober and to pass drug tests and to really heal instead of just get clean. So it'll work in the long run, which is the goal, of course. And then with the gender-specific support and a collaborative effort between the casework team with your all different kind of like areas coming in together to work eclectically, we think that will be really successful. Thanks.
Thank you.
Bye.
Wait, it's the recording, guys.